Have you ever wondered how plastic surgeons perform tip rhinoplasty surgery? The first step in this rhinoplasty, which is an open rhinoplasty, is to make a cut in the columella, and that's then continued inside each of the nostrils. A tip rhinoplasty is performed when a patient wants to change the shape of the lower 1/3 of their nose, otherwise known as the tip. And this can be, for example, if someone has a round bulbous nose like I'm demonstrating here. After completing the incision, I then actually use a Q-tip to gently push the skin and subcutaneous fat layer off the underlying lower lateral or alar cartilages. These two cartilages here are called the lower laterals, and they give us our shape of our tip. And this is what we manipulate to change someone's shape. This lady has a bulbous tip, so we want to reduce the size of these cartilages and we want to make them pinched in together to give the tip a more refined, smaller look. So one of the things we do is a cephalic or top reduction. We actually cut away some of this cartilage here. We do a cephalic trim on both sides of the cartilage, and this cartilage is actually very soft and malleable. It's the same type of tissue that we have inside of our ears. So if you feel your ears, that cartilage is really soft. Now that we've cut them, we can just remove those top pieces of cartilage, which is going to make the tip look smaller already. And the next maneuver to refine the tip is to actually put some stitches in the tip of each of these cartilages. So we'd go in this side, out this side with our thread, then from the other direction back in this side and into the middle. And when we pull that tight, it actually gives the effect of making the tip pointier. I've finished suturing and shaping these cartilages, and as you can see, they're not as bulky, they're finer. What I've also done is put in some stitches between these two cartilages to create a kind of diamond tip effect, which gives a really nice subtle effect to the nose. So I've completed putting in the stitches into each of the domes of the alar cartilages, and then I've actually stitched them together. And what I'm aiming for is a bit of a diamond type shape, because once the skin is put back down, that gives a really nicely defined, slim nasal tip. After manipulating the cartilages, I've placed the skin back down. I'll close up the incision in the columella and also inside the nose with some fine stitches. All that's left to do is to put on a nasal splint just to protect that. I usually use that for about 2 weeks to protect the shape and stop it being injured by bumps.